know that your time is valuable, and for students, you're providing it along with the base, so thanks for coming. So I am here to talk about the whys and hows of pre- and postnatal fitness, because this is a subject that I am very passionate about and is very dear to me. Just to know, I will introduce myself briefly, then we'll talk about prenatal exercise and exercise once baby is here, and then we'll kind of do a sum-up takeaway and answer a few questions if there are any, and then show you a few demo workout moves. I really want to thank Janae and Cassie for coming and helping me. Janae is 18 weeks and Cassie is 32 weeks, so there are different stages in the pregnancies. Again, I am Shauna Cheshire. I am married. I have 4 kids. My kids are getting big though. My baby is going to be 8. My oldest is going to be 16. So they are growing up. So if you ever doubt they'll ever grow up, just know that they actually will. Sometimes you doubt that. I am a labor nurse. I still currently do that. And I also teach childbirth education and preparation classes. And I also do fitness. I graduated from Weber State with both my nursing bachelor's degree and my bachelor's in human performance management. And so that's kind of my background. And I'm really passionate about the subject because I feel women need to know more about exercising during this time, because we're showing more and more through research it's very beneficial. And building strong foundations for women and their families is really important to me. And secondly, or lastly, I guess that would be lastly, my own pregnancies would have been better, and I think I would have loved to have resources like this when I was going through it. So let's talk a little bit about prenatal exercise. A common myth that I think is still perpetuated a little bit is that pregnancy is a very delicate time and that women are kind of fragile when they're pregnant. So exercise might be risky or altogether unsafe. That it's just better to be avoided. Hopefully we're breaking out of that, but you know, back in the last century, it was pretty common that you were told to rest up and don't do anything strenuous and eat for 2, and that was just kind of what our culture embraced. And we found there's a whole lot of wrong about that. So what we do know now is that most women are classified as healthy and low risk, and they can exercise, and doctors and midwives are now encouraging exercise in this population. And we're going to talk about that. Unless there are complications existing, that's what we want to do. So if everything you get advice from doctors or other professionals that are in the health field, there's always risks and benefits to everything. And so for women who are low risk, the benefits of exercise are showing to be greatly outweighing any potential risks. If you're a woman that's identified to have a certain condition or pre-existing condition where exercise would be more risky than its benefits, well then that's why you include a doctor or midwife in your decision on whether you exercise and what that should look like. So what is in it for you? If you decide you're going to go ahead and get into exercise while you're pregnant, there's a really great advice that the American Council of Obstetricians and Gynecologists, also known as ACOG, that's their professional organization for OBGYNs. They are now encouraging women to exercise moderately, at least 30 minutes a day, most days of the week, if not all. And the reasons why are these. It can help reduce a lot of common pregnancy discomforts like backache, constipation, bloating, swelling. So for women who have gone through pregnancies and hadn't exercised and then had experienced another pregnancy later on when they did exercise, almost all of them say they felt better carrying the pregnancy when they were exercising, and that they just felt better. So that's a great thing. Everyone wants to feel better. Also, treating or preventing gestational diabetes. Not sure, is anyone unclear about what gestational diabetes is? I throw these terms around like everybody knows. But it's a form of diabetes that is brought on by pregnancy and usually, hopefully, resolves once the pregnancy is over. Also, the general population, as well as pregnant women, can experience increased energy, improved mood, improve posture. And posture is an important one because if your posture is better, you're less likely to have back pain and other avoidable aches and pains of pregnancy, which is important. So if you see someone waddling at 6 months along, she's not going to feel very good. She's already not really holding her core strong, and she's just kind of letting it all hang out, and she's probably going to have a lot more aches and pains than a mom who has strong trunk core muscles. So those are important. And we want to promote more muscle tone, strength, and endurance at this time because of those things. Also, better sleep, and I think everyone likes to sleep better and feel more rested. And pregnant women generally really have a hard time with that. So if you can improve sleep, it's good on you to do. And then also you can increase your ability to cope with labor and that whole experience of birth if you are in good physical condition going into it. And you usually do rebound much faster after the pregnancy is completed and you're recovering after if you've done that. So I love this meme. It's one of my very favorite things because I love to run and I like to think I look like her. Maybe I look more like a little girl at the bottom, but anyway, when I run, I like how I feel when I do it. My question is, are pregnant women really feeling like this is an event they're training for? And whether you want to buy into this whole thing or not, when you got pregnant, whether it was planned or not planned, you registered for an event. You bought a ticket for a future athletic event. And some people who will go and decide to do an event with their friends, whether it's a bike race or a foot race or whatever, say a woman is like, yeah, let's do this together, let's register, and they both sign up. One might say, okay, I'm totally training for this thing, I want to feel awesome, I want to run a good race. So she adopts a lot of those practices, gets out there and practices at her sport and gets out there and does it. While her other friend is like, there's a lot of stuff on my plate, I'll try and get a few sessions in here and there, or maybe not at all. Well, we know that event day is coming, and unlike an event where you can just decide last minute, I think I don't want to do this now, pregnancy is not that way. You're going to complete this journey whether you're ready or not. So I just really want to help women feel and respect the process, to know that you're asking a lot of your body. You want your body to be in good condition going in. So a lot of people wonder what moderate exercise is, because that's the current recommendation from ACOG as moderate exercise. So this is a scale that is a modified scale, because we know 0 to 10 scales pretty well, and this is an intense perceived exertion scale that's been modified to be our 1 to 10 we're all familiar with. So 0 would be laying on the couch watching, the TV or playing a game on your phone. Absolutely no exertion whatsoever. And 10 would be an all-out maximal, this is the most I am physically capable of doing. And what we really want is women to be right around 3, 4, 5, maybe going into 6 on the scale. Working hard is okay, but I always tell women, if you feel too breathless to talk in a workout session, you're probably in the very hard range and probably need to table it back a little bit. I mean, it's the talk test we've heard a lot about forever, but that is a really good way to know if you're kind of moving into working a little bit harder than you really need to be. And there are some very athletic women who are, competitive athletes that can go through a pregnancy and they still train their guts out compared to most people. But for the general population, we want you to feel good working out when you're pregnant, and we don't want you to feel like you're totally expending everything in your workout and having a hard time with energy after. So that's why those exist. Physical activity during pregnancy can curtail excessive weight gain in pregnancy. And I had one of the gals I trained who told me her OB had read an article that said pregnancy is the #1 cause of obesity in America right now for women, which she found very fascinating, because a lot of women who start their childbearing years fail to recover their prior condition before getting pregnant again. So after a few pregnancies, they're done, maybe they're in their 30s or 40s, they're done having babies, their body's been really hammered, and a lot of times they're quite overweight, and that can be really depressing. So if we can curtail excessive weight gain, women are going to gain weight in pregnancy. Most all of them are recommended to gain some. And your OB or midwife knows, according to what your pre-pregnancy weight was, what is a recommended weight gain range for you. But we don't want to go above that, and exercise can help us not to. So moderate exercise for a minimum of 30 minutes a day, most days, helps set you up for the likelihood that you'll just gain what's needed and not over that. The other reason is we want to lower rates of pregnancy and birth complications. And does everyone know, or anyone not know, what preeclampsia is? This is a term I don't really use. Okay, so preeclampsia is a condition that can develop in pregnancy. Not every woman gets it, but it can cause the really small capillaries in different areas of her body to get leaky and cause swelling. So it can cause everything from just generalized really bad, foot, ankle, hands, facial swelling, to complications where the capillaries in the kidney area where the filtering happens get leaky and she starts to spill protein into the urine. There's a few other signs and symptoms, but what we really want to avoid is eclampsia. I don't know, does anyone watch Downton Abbey in here? Please someone say yes. Okay, Lady Sybil went down with eclampsia. So she was pre-eclamptic and then she proceeded to full-blown eclampsia and had that seizure. So while we can manage it really well, much better, obviously, than they did back then, it's still a pretty major complication that may alter the course of the pregnancy. So we don't understand why it starts, and we can't interrupt the cascade of events in the body once it starts. But if you can lower your risk by 30%, that's the best thing I've seen so far about helping to avoid preeclampsia. Also, a lower risk of gestational diabetes. There's been research shown that women who exercise pre-pregnant and then go on to exercise during the pregnancy have a lower incidence of development of gestational diabetes, which makes a lot of sense, but it's actually now proven in research that that's the case. And if you do get diabetes in pregnancy, it's a really important part, exercise is, of your treatment plan, along with any medications or diet alterations. And then this is a really big one, that a woman who is healthy and low risk, exercising is actually at a lower risk of delivering a baby preterm. So where a lot of people, I think, thought if you exercise, you were putting yourself at risk for an early birth, that has not borne out, and actually the risk is lower for those women. And then another thing that I think it would impact our system the best and be best for mom and babies is if we could avoid unnecessary C-sections. There's a significantly lower rate of C-section and forceps and vacuum-assisted births in women who were exercising before they got pregnant and who continued, and especially if they were exercising during pregnancy. And in 1990, OBs were not sure what exercise did for women in pregnancy. They were concerned that perhaps their hypothesis when they did this test was that the exercising moms would actually have more complications. So it goes to show you the bias that existed at that time, and that's not been all that long ago. So when they put women into the study, half of them, they said, they were all previously exercising and active. So when they enrolled them, they said, okay, this half, you guys stop exercising at the end of the first trimester. And then you guys go ahead and keep exercising throughout. And they just let time play out. They crunched the numbers and watched the data from how did their labors go, what their outcomes were like. And what they did find out was that 30% was a kind of standard C-section rate across the country, and that was what they found in the control group of women who didn't exercise. It was about a 30% C-section rate. In the exercising group, it was a 6% C-section rate. So the biggest reason that is there's a significantly lower incidence of fetal distress or heart rate problems in the baby going through labor. And I could talk an hour on that alone, but we'll go on because I'll address it in a minute too. Also, shorter, more effective labors are a result of a woman who's in good shape. And I think everyone would like a shorter, more effective labor if you could get that. So if you aren't already exercising and you're pregnant, you might think, well, my doctor said I could keep doing whatever I was doing, but what if I wasn't doing anything? Am I kind of screwed? Do I get to exercise or not? Is it safe or not? What they found is that pregnant women who are medically cleared, and that's an important distinction, you've been to your doctor and he said, sure, you're good. They can start exercise under supervision and actually see fitness improvements without harming their themselves or their babies. So that's important to know. And that exercise can be started if you've been previously sedentary, but the program should be carefully structured and monitored for you. So what does your baby stand to gain from all of this? In essence, we haven't identified any risks to your baby through exercise, but we're seeing more and more benefits, potential benefits. And we'll talk about these real quick. Optimal birth weight of baby seems to be one. They've studied this a lot, and babies born exercising moms tend to be right on a nice target range of weight, but they're not too big and they're not low birth weight. So that's important. Also, increased brain power, possibly. They did intelligence and language testing on 5-year-olds of women who were exercising during pregnancies with them versus a control group, and they found they scored higher. And I think more research needs to be done there, but that's a possibility. Also, decreased fat stores from birth. They map these kids, and they're born lighter and leaner than their moms, babies that are born to moms that are sedentary. And then they've tracked them over the years, and at 5, they still seem to be at much less risk for obesity at 5 years old than kids that had a mom that didn't exercise. So the data is going to still be gathered, or research will still be happening. The question is, what is that mechanism? How is it actually accomplished? Is it fully understood? But when you think about it, if you're born with fewer fat cells to begin with, you're kind of set up to be less likely to battle with that. Not to say it's not possible, or that a kid who had an exercising mom is doomed to be obese. That's not the case. But we're just talking stats and playing the numbers. And then this is the last one that I personally get really excited about this. A stronger heart muscle for your baby is a really great reason to do it. They have found, obviously we've known it for a long time, when moms exercise, their heart rate goes up. We know when you exercise, your heart rate goes up. They would watch the babies, and their heart rate went up too. And for a while, I think that concerned physicians. Was that safe? Was that okay? Was it detrimental? And they really erred on the conservative side, saying, maybe pregnancy is not a really good time to exercise. But what studies have shown us is that exercising moms have babies with lower heart rates. There's a range of normal for babies in utero, and their babies tend to be on the lower end of normal. And so that means their heart is more toned, just like a training effect in a grown-up walking around or running or cycling. So when mom's heart rate goes up, baby's heart rate goes up as well, and they get like a little passive exercise for their hearts. And that's awesome. What they found is those babies are much more efficient in pumping blood around their little bodies. And when they go through stressful times in labor, when they elevate their heart rate, they can push a whole lot more blood around than a mom who didn't exercise and baby didn't get that training effect. This is my favorite thing that I read the study where this Linda May, she's a researcher at Kansas City University of Medicine, has been doing research on this, and she said this exposure to maternal exercises influenced the way the nervous system and the way the heart has developed, so that even after the baby is born and is not being exposed to mom's exercise anymore, you still see differences. That heart is already born healthier. So they have mapped these babies out, and their heart rates seem to be lower than their little counterpart friends for up to a month after birth. So it just goes to show you there was a real effect happening. It wasn't transient. So if you now think, okay, I buy in, I think exercise in pregnancy is important, there's still a lot of questions I'm sure you have, like what is safe to do? And these are by no means all the safe options. I'm just listing a couple that are really general. But for most people, walking is good for pretty much anyone, as long as you have a safe place to walk and you feel safe there and there's not a lot of tripping hazards, that kind of stuff. Also, swimming or water-based exercise, a lot of pregnant women feel very comfortable doing it. The buoyancy creates kind of a weightless and supportive effect. And it does work a lot as long as you were running before and in good running shape. Oftentimes, though, you'll have to modify your intensities and your durations as you go through the pregnancy. And then here's your important ones, what to avoid. My biggest question I have moms ask is there a higher risk of fall? or impact with objects or other players? That's the number one question, and if you say, yeah, probably, then that's probably a good thing to not partake of at that time. Specific ones, examples are downhill snow skiing or water skiing. There's a lot. Altitude could be a problem with snow skiing, but also just the fact that you're on little sticks and you're going down a mountainside on snow. Like, really fall, maybe. And you can't always control how you fall. So, also contact sports, hockey, soccer, those type of sports, you can't really control the field of play or the events that will happen. And so you could have some trauma occur to you, and that's probably not the safest position to put yourself in. Also, scuba diving, because of the decompression sickness that can happen to your baby, it's just never considered a safe activity when you're pregnant. And then once you're 20 weeks and past that, you want to avoid prolonged laying on your back for prolonged periods. So exercising on your back for a long time. I mean, people roll over. I help moms all the time come and say, I woke up on my back yesterday morning and I freaked out. I'm like, you're okay. I mean, you just don't want to purposely just lay on your back all day, You're okay. Because of this position, it can impede blood flow and oxygenation to you and to the baby. So that's why we want to avoid staying in that position for a long period of time. And then the other thing I want you to think about is, does it require quick twisting motions? Does it require lifting heavy weight overhead? Or am I doing other movements that cause discomfort? And if that's the case, then we need to do something else. And I feel like your body really does know what's best for you if you listen to it. So, a couple of warning signs. You would want to stop exercise and call your provider if you have any of these happen. And they're not very likely to happen during exercise, but you want to know. If you're experiencing any vaginal bleeding, if you feel dizzy or faint, if you get an increased shortness of breath. So if you've been doing this workout for a while, but today, man, you can't hardly catch your breath and you're not doing anything different, that would be something you would want to do. Because shortness of breath kind of gradually comes on through a pregnancy, and most women can identify with feeling short of breath from time to time. But we're talking about extreme changes in how you're feeling. Also, chest pain is never an okay symptom to feel, so you would want to let them know about that. Headaches, especially if you're not normally a headachy person and you get a really bad headache one day that's just crushing and really debilitating, comes on fast, not usually your thing. If you develop sudden muscle weakness, if you get calf pain or swelling, this one's kind of weird. I think people are like, what is that about? Have you guys heard of DVT or deep vein thrombosis? Okay, so pregnant women have a higher statistical odd of getting a DVT than the regular population, normal population. So a DVT, those are just symptoms of a DVT. Do you have a red spot on your calf? Is it tender to the touch? Is it swollen? So that's what that's there for. Also, contractions. Your uterus, some women will say, I contract when I work out, but then when I stop and I finish really hydrating and I rest, they go away. I'm like, you're probably fine then. You just have to really listen to your body and compare it to what you've been doing normally. For some women who exercise, they never contract when they're exercising, but today, man, they're exercising and they're contracting a lot. Well, then that's different, and she needs to respond to that and probably stop, rest, drink, and see if they go away. But if she's due, she's probably like, I'm just going to keep going. These things happening. Also, if you're worried about your baby's movements being decreased enough that you're worried about baby's well-being. And then if you have any vaginal leaking of fluid, that you would definitely stop and seek attention for that. So that's the prenatal part. Any questions on any of that before we go to the postpartum? Yeah.
So just walking, can I still get all those benefits that we had talked about before even, because obviously running and, you don't think of walking as being the most hardcore.
No, and it doesn't have to be. If you work out and do some light weights on some days and then just say, I'm going to try and get a 30-minute walk every day. Every day I don't go to the gym. It's 30 minutes a day minimum, and walking is a great thing. And if there's a day, I can't get to the gym, how many times do we set ourselves up to do this? I'm going to go to the gym or to X place and work out. Something happens and interrupts that. You tend to just write yourself off for the day and say, well, opportunity lost, But with walking, you can pretty much walk almost anywhere and take the opportunity to catch a walk in. And it does do a lot of good, actually.